Hey, YouTube viewers. Thanks for joining me here for End of Life University. Today, I'm sharing with you an interview I did with Emma Payne. She is the founder and CEO of Grief Coach. This is a company that provides personalized text messages to people who are grieving and also to their supporters. And it's amazing. I signed up for it, so I'm receiving those texts myself. And we have a great conversation, and I'm really excited for more people to learn about Grief Coach. So take a listen and see what you think. Today, I'm so happy to welcome my guest, Emma Payne. Emma is a seasoned technology entrepreneur, a graduate of MIT, and she's the founder and CEO of a company called Grief Coach that supports those in need. Grief Coach combines her passion for mobile technology and engagement with her deep commitment to giving people the confidence and tools they need to support each other through grief. And we're going to be talking all about Grief Coach. You can learn more at the website grief.coach. So, Emma, welcome and thank you for joining me today.
Thanks for having me, Karen. Nice to be here.
Well, I am at this current time a user of Grief Coach, so I'm
Oh,
really
you are?
excited to talk to you
Yep.
about it, and I can share my experience with it later on. But I wondered a bit about your own story. I know you've said you've probably told this a lot, but about what inspired you to create Grief Coach, because I know you've been involved in all sorts of projects and technology innovations in the past.
Yeah, I think like most people that work in bereavement, there's a sad story at the beginning. But for me, really, it was so my friend died in 2015, and it was the first time I'd been with someone when they died, and it had been a difficult 6 month terminal diagnosis. And during that time, he had asked me if I would speak at his funeral. And I, of course, said yes, of course, anything you want. But after he died, it was a daunting ask because he was the best friend and also second cousin of my husband, who had died a decade prior by suicide. So essentially, what I'd agreed to do was fly across the country and see hundreds of people, many of whom I hadn't heard from in a long time. But in the end, I really do think of it as a final gift from my friend. From the moment I sat down in my pew in the church, the woman to my right was like, what's your name and how did you know the family? And I said, oh, I'm Emma. And she starts crying. Oh, are you Barry's widow? And I said, I am. And she said, oh, well, I'm his aunt. And I said, yes, I know. And she said, I'm so sorry we didn't reach out. We didn't know what to say. It was really shocking. We didn't know anyone who had died by suicide before. We did worry about you. Then so much time passed, and then we felt embarrassed. And I essentially heard a version of that story probably 100 times over the course of the funeral and the pub night and everything that weekend. So by the time I got on my plane ride home to Seattle, I just thought, this is crazy. I had a couple of decades experience building web and mobile tools at that point for everything from suicide prevention to youth voter registration. And I just thought, I spent 10 years not hearing from people and inventing all kinds of reasons in my mind for why that might be, particularly because my husband died by suicide. So, were people angry with me or who knows? But equally, 100 people spent that same 10 years feeling genuinely bad, ashamed of themselves, guilty, upset. What was an opportunity for connection had, in fact, just been an absence of connection. So I used my plane ride home to map out what basically became Grief Coach. And I fully assumed that by the time I taxied into SeaTac and got on Wi Fi, I would see that it existed already. But it didn't. So I started working on the plan in 2016, sold my house, tried to build a prototype, and went live in February of 2019 with, of course, no idea what was around the corner for us all at that point.
Yeah,
So,
definitely. Well, I resonate with your story so much because I don't know if you know, but my father died of suicide a long time ago. But I had an experience very similar to yours of not hearing from people that I cared about that mattered to me, not
mhm.
understanding why. And it was many years later when I got feedback from quite a few of those people that, oh, I wanted to reach out. I didn't know what to do. I didn't know what to say.
Yeah. Well, that's the exact pain point that sits at the heart of Grief Coach. That's why I do what I do every day, because of that exact experience, which is sadly very, very common.
And to think of, excuse me.
Of course, this is the time for the frog in the throat.
Yeah, definitely. Okay, hopefully I can finish with that. Um, yeah, definitely that lack of connectivity between all of these various grievers, and I didn't realize how many people were grieving my dad's death
Mm,
who did, I mean, I was his daughter, but people who were grieving in their own ways, who knew him
yeah,
knew him differently than I did,
right,
who were going through grief. I had no idea. And it seems like we could have been a community
right.
supporting one another through that time instead of all isolated by
Mm,
ourselves, dealing with all this pain alone.
mm. Yeah, oh, I tell the story often about this young woman whose first child was stillborn, and she was, of course, devastated because her baby had died. But I describe her as being preoccupied with how alone she felt. Her husband wouldn't even talk about the baby. Her best friend had flown in to help with the baby, but left 2 days later saying, I don't know how to talk to you about this. I don't know how to be with you right now. Um, and that I think that what could be community and sharing is often a very isolating, lonely experience for many grievers. Yeah.
And partly because we're as a society so uneducated about
Hmm.
grief.
Hmm.
We have so little experience about how to grieve together and how to
Hmm.
support one another. And it is daunting,
It's
actually,
very
to
daunting.
know what to say or what to do for someone, especially if it's something you haven't experienced yourself. So I understand that. I had compassion for all those people who didn't show up,
Yes, me too.
but
Yeah, in fact, that's where we work very hard. I have a pet peeve now about the, top 7 things never to say to someone who's grieving. We are firmly on the side of the supporter that isn't sure what to say, but loves their person and wants to help. In our experience, most of us are lucky to have at least 1 or 2 people that want to help and just don't know how. No one's taught us. There's no
mhm.
point shaming the supporter and making them feel worried that they might say the wrong thing, because that's what leads people to stay away, which is the worst possible outcome.
Yeah, that's interesting because what I felt exactly was I don't care if you say the wrong thing. If
Yeah.
you're here, if you show up, if you brought me a pot of soup, it won't matter to me as much what you say. It's that you came and that you
Hmm.
cared.
Hmm. Yeah, absolutely. It's really this is um, happy to have the opportunity to talk about what we're doing at Grief Coach, but this is precisely the space that we're operating in, and it's so heartwarming and amazing to see that people do want to help, and with a tiny bit of coaching and suggestions and reminders sent to their phones, they can lean in and do the things that as grievers we want them to do, the pot of soup or whatever it might be. So
Yeah. So tell our listeners how Grief Coach works because I get to be on the inside since I've never been myself, but let's tell everyone what it is and how it works.
yeah, yeah, I'm so proud of it. It's so Grief Coach is a text messaging service. We are not an app. There is nothing to download. It is very, very, very simple to use. You sign up online, it takes about 5 minutes, and you share as much as you're comfortable sharing about the person that you've lost. So if you want to just give us their name, um, that's okay. But if you want to share holidays that are important to you, cause of death, the anniversary of the death, we will then send you texts for a whole year, at least twice a week, with expert, personalized, practical suggestions, resources, tips for your grief journey. And then my favorite part is that you have the option of adding in up to 4 friends and family who want to help and might not be sure how. And if you do that, we will also text them um, date reminders. Hey, tomorrow would have been Karen's dad's birthday. Why don't you reach it, right? resources. Here's a 1 minute video about how to support someone after a stillbirth. And the griever has the experience of a few people that are important to them, knowing that they're supporting them. And the supporters are frankly relieved, right? The husband is like, thank you so much. She was crying all the time. I didn't know what to do. Really appreciate you letting me know that tomorrow was her dad's birthday, or suggesting that I make a reservation at her dad's favorite restaurant, or whatever the thing that the supporters are relieved because they want to help and they're not sure how. And the griever now has that experience of it's not up to them to try and, in the midst of their grief, educate other people about how to support them. We're doing it. We're doing that work for them. So it's full year of text support for grievers and their supporters, personalized based on a whole bunch of things, but dates, age, cause of death, relationship, and so on.
And I have to say, my experience as a griever, I signed up and entered in information about my mother's death, which happened more recently than my father's. And I had sort of forgotten that I signed up for it. And then on the anniversary of her death, there came a text message that was so lovely and so supportive. And I realized that I honestly didn't have anyone that I would call and talk to about my mom's death that day, that I felt like, well, who else will care about this like I care? But this text message came that was like, well, now I have someone.
Mm,
It's a text message, but it's as if there's a person, there's someone reaching
mm,
out who knows that this is the anniversary of my mom's death and who cares about that. And so it was like this lovely surprise. I'd
yeah,
kind of forgotten to expect that that would come. So the
yeah, that's great.
messages have been wonderful. And then also as a supporter to other people grieving, I know I myself have found it's really hard to keep in mind all of the dates
Mhm,
that might be special to someone who's grieving, the birthdays and anniversaries or special
mhm.
holidays, that it's very hard to stay aware of those things and remember to reach out as much as you want to and want to be there at the right times. It's just in our busy lives, sometimes it isn't possible and things slip by us.
Of
So
course, yeah. Then there's only so many things you can have in your calendar, and no, I think that's exactly right. Thanks for sharing. Our content team works very, very hard. We have at this point over 100 different expert contributors, so we focus on making sure that everything we send out is um, empathetic, practical, personal, but it's also evidence based and trying hard to make sure that we're lining up with things that can be helpful in our grief.
and I wanted to say the messages have been right on point for me, exactly the right tone. But also, I mean, my mom was older. She died at the age of 89. But the messages also reflect upon that, about losing an older parent and what that experience is like.
Mm-hmm.
So I really like how personalized the messages are to the type of loss that one has.
Oh, I'm really glad. Thank you. Yeah, we personalize messages based on timeline in a couple of different ways. So on the back, so for the user, it's very simple. You sign up and you get text, and as you said, hopefully we're on point mostly. um, but on the back end, we do have all kinds of personalization work happening, and we look at timeline in two different ways. We look at the time since the death and also the time since the subscription began. You know, when I first started Grief Coach, I naively thought that people would sign up for subscriptions when someone died. Well, that is not necessarily the case. Sometimes it's a year later, 2 years later, 5 years later. And now therapists tell me that this is quite common. You know, sometimes in the first year, we expect to feel sad. But if we're still feeling deeply sad or stuck in grief a few years later, that might be the time that we reach out. So we're trying to look at timeline in different ways. We try to look at age in different ways. Yeah, age of an older parent who's died versus a child who's lost a parent. We have a teen series, so there we often get loss of a parent at a younger age. For widows and widowers, again, the age does make a difference, right? Widowed at 30 versus widowed at 60, let's say. So Yeah, I'll pass your feedback along to our content team because they work really hard on the messages.
Yeah. Well, and I've noticed there's a variety. Sometimes it's a little poem, sometimes it's a link to a short video to watch. So it isn't just constantly messages of comfort directed to me, but there are other resources available, and that's really nice as well.
Yeah, we've been working with more and more um, expert contributors who are so. I mean, here's the thing. This is not, we're not waiting for somebody to invent a vaccine or discover the best way to support grieving people. There's centuries of wisdom and expertise. The world is full of people with an incredible depth and range of expertise when it comes to how to support someone who's grieving. So for us, we don't need to make this stuff up. The wisdom is there, and what we've built is a very efficient, practical, I think, way of delivering the wisdom at the right time, right into people's hands. But
Yes.
each time we start working with a new expert contributor, I think we did a new series working with this pediatric ICU nurse named Weiwen Sato, and her work is with grieving parents, ICU, also work with grieving clinicians and what it's like to work with people who are dying in a clinical setting. So then we create a body of texts with Weiwen, and then those go out to the people that we've tagged for, and the messages made me cry. We just
Mm.
finished a new series for people who've lost a child, a young child. Again, the expertise is there, so we just try to find people with the words and experience, do our best to edit it down. We're talking text, so short, 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 digestible, which I think is also really good when we're grieving. No one, I couldn't read a book for years after my husband died. It
Mhm.
needed to be short and just for me. And I think at the beginning, I chose text because I thought that would be the most scalable and affordable and accessible. My hope is that no one ever have to grieve alone. So I was thinking, what is the most efficient way to support as many people as possible at a really low cost? But we've been delivering texts for over 3 years now, and I've come to realize that it's not just that it's scalable and accessible and affordable, it's also really nice to get support by text. It's private and personal, and we think of text that way. So we hear from people who say, I haven't deleted any of your texts. I save them for after third period. That's when I read back and think about my mom. I think that text is actually underutilized as a support because it is really simple. You don't need to remember to open an app or download something. You don't have to have a video connection. We just text you things and you look at them when you're ready.
I think that's a good point. Technology wise, text messages are pretty accessible to most people who have a smartphone. They're used to getting texts as a way of communicating,
And it
even
feels, yeah,
older people.
yeah, I think we don't even really think of it as technology in a way. And I mean, we're getting a lot of subscribers in rural areas, for example. We have one woman who renewed a couple times already, so she's into her third year. And when I chatted with her, she's in rural Pennsylvania. Her dad was a funeral director. She grew up living on top of a funeral home. And her mom was a hospice nurse. And she lived in this small town, and she felt that she had grown up knowing exactly what kinds of grief support were available in her small town. And then her sister died. And she found Grief Coach, I think, on Instagram. And we start sending her, podcasts that she hadn't heard of relating to loss of a sibling in your 20s. And she was saying, in some ways, the more inaccessible other kinds of support might be, if you're in a rural area where there aren't the support groups and other things available, then the more appreciated the text was. We were texting her resources that she didn't know about.
And I would think, particularly during COVID, like it was fortuitous that Grief Coach was available for these past 2 years, because when grief support groups haven't been able to get together, as easily. And I think people have felt more fragmented and more isolated in their grief during these past 2 years. Did you see any upswing in the use of grief coach during COVID?
It's hard to say because we were so young. So we launched in February 2019, and March of 2020, we had to sort of pause everything and add a whole cause of death to the system, which was something I had never imagined doing. Worked with Virginia Mason to try and start looking at the particular kinds of support we want to provide to people after a COVID death, right? You weren't with your person at the end. Um, all the things that that population is experiencing. Um, so in 2020, I think we had the same experience that any 2-year-old company would have had, honestly, which is everyone was freaking out. No one was really investing in new technologies, even if the technology was something that could meet a need right then and there. What did happen, though, is that grief was getting talked about in a way that it never used to be. So one of our expert contributors who I had worked with on our drug and alcohol death series said, I've been doing bereavement work for 30 years. Even my friends don't really know what I do. And now all of a sudden she's being interviewed by Rolling Stone. So there was an elevation. We got quite a lot we had a big NBC piece, New York Times. So I think we did the grief conversation as a whole was elevated, which is a good thing. We, as you said at the very beginning, Karen, we're in such a sort of grief illiterate, fearful world where we're not good at talking about it. So I think that 2020 did provide some value in that the conversation was happening more. On the policy front, we were doing quite a lot of work helping to advocate for a White House Office of Bereavement Care, the CDC started measuring bereavement for the first time. But really, it wasn't until 2021 that I would say, as a business, people started to think, oh, wait, this is a way that we can support more people. And by 2021, the numbers were so out of hand that
Mhm.
there was no keeping up with it. Every single person we ever talked to, hospices, grief organizations, children's hospitals, anybody who was trying to support people through bereavement was unable to keep up.
Mhm.
Not just because of COVID, right? We had COVID deaths, but we also had increasing death rates um, in other ways. Our overdoses were skyrocketing. Hospice bereavement teams were being asked to do more in the community, and that was things like suicides and drug and alcohol related deaths, homicides. And on top of that, a lot of the normal supports weren't available. The support groups were shut down. So I think there were more deaths, less traditional support, longer wait lists, and I think probably also just an necessity is the mother of invention. Like, we might not think that text is the most awesome way. We, being a hospital CEO, for example,
Mhm.
might not think that text is the best, but if it's what we can do right now because everything else is shut down, then we'll try it. And then what happened is we started getting pretty incredible feedback and discovering that actually text can be pretty awesome because it's for you and the people around you, and it's all year long, and it remembers the key dates, as you're saying, with the anniversary of your mom's death. There's no bereavement coordinator that could do that for 1,000 grieving families in the course of a year.
Mm.
So the COVID journey has been weird, as it has been for everyone. And it was also personally challenging for me with my kid's dad in another country and closed borders and whatever. So I think, like everybody else, it was difficult.
Yeah, a very challenging time, and we have not yet even seen, I think, the full extent of what's going to come from this time.
There's
That
early data coming right now, and it seems to be coming quite quickly all of a sudden. And it's about increased death rates from things like cancer and heart disease because of low early detection. During COVID, people didn't go in for screenings. And now we're unfortunately seeing spikes in whole other areas. So it's just been, yeah, it's a heartbreaking time.
Yeah, definitely. Well, I wanted to go back to a while ago, you mentioned something about text-based support for clinicians.
Mm,
And I am really interested in that because I've been concerned for a long time about, as a medical provider myself,
hmm
having little support for or even acknowledgement of the grief that medical providers experience when their patients die. And
hmm
particularly during COVID, now I think we have acknowledgement because we've seen
So
doctors and
much.
nurses really suffering through
Hmm
the horrendous numbers of deaths that they've dealt with during these couple of years. But I've often wondered, like, how can we help clinicians with their grief? Because in some ways, it feels like disenfranchised grief. Like
hmm
no one expects you to show up at a funeral. No one, you're not really part of any of the traditional methods of
hmm
grieving with other people, and yet if much of the time you still feel it, you still carry it within that loss. So anyway, tell me more about that. I'm interested in that.
Yeah, I would love to hear more of your thoughts about it. It was so the the messages that we have for clinicians are, to me, so they educated me about what that experience is that you're describing, right? As we worked with our expert contributors and crafted the text, I just realized, yeah, this is things that I hadn't thought of either about what it is to walk with families in a clinical setting and see this amount of loss. And of course, they bring it home. I mean, we learned that doctors are not even trained in death at all. We actually, I've never done this before or since, but we entered this like health hackathon competition with a company called Olive, and we won the grand prize. And our rollout is actually embedded into their system, which sits in something like 30% of US hospitals, so that when a doctor or a nurse enters a word, say like deceased or patients died, or does certain behaviors on the computer, our suggestions and tips come in right away for that doctor, for that nurse. You're going to walk back in to the room with the family. Here are some things that you can say,
Wow.
and then offering the ongoing support to them after the fact. So, how to support the family in the moment, because they're not trained in how to do that. And the way that a family hears their loved one spoken about at that time when they died matters. It sets the stage for what comes next. We hear this all the time. So it's like supporting the clinician in the moment so that they feel supported themselves. Okay, someone's going to help me know what to do now, because this is, you know, quite possibly the most emotional moment in the lives of the people in that room over there. I'm going to go in with no training and try and support them, and I don't feel supported. And I've been caring for this person, and I also watched them die, and that's on top of all these other deaths that I've been witnessing. So we work with Megan Devine, who
Mhm.
does an incredible amount of work with clinicians to actually craft the messages that go out in that hospital system with all of that I just mentioned. And then adding in additional experts like Wei Wen Sato, who focuses on pediatric ICU work and clinician grief. And I love the messages. I wish that every doctor, nurse, social worker could receive them, because to me they're just so, they acknowledge the journey, what it is to be part of a continuum of care where you have one thing happening here and another patient over there that has a different, how difficult it is to be part of that handoff, and to feel that you're supposed to, that it might be unprofessional even to cry or to feel anything,
Mhm.
when in fact the opposite is true. It's okay to bring your heart to work, and look for ways to manage that as opposed to pushing it down. And this is, we're seeing all kinds of negative health outcomes with our clinicians, in terms of anxiety and depression and suicidal behaviors. Even we're seeing this huge amount of attrition, right? 25% of nurses leaving their jobs. We have to acknowledge the pain and loss and suffering that our clinicians face every day if we want them to keep going and doing that, so that they can find strength in it. So I think it's really important work. It's quite new. We just started about 6 months ago. Um, but I agree with you. I think it's overlooked and it really important.
Wow, that's beautiful. I have goosebumps because I've long thought this, that we have to find a way. We have to find a way to help clinicians in the moment when they're experiencing the loss and when they're trying to figure out what to do next. And I thought it wouldn't matter how many workshops I taught to
Mm-hmm.
doctors, they would have received that information at one time, but it's not going to be top of mind when they're caring for a patient in the ICU. It won't necessarily be there for them.
Mm. Yeah, this is what Megan says as well. Megan Devine, who does all these workshops with clinicians. I mean, first of all, you can only reach so many people that way, and it's not at the exact moment that they need it. So I'm
Mhm.
hopeful that this new piece of work that we're doing with Olive, where it actually comes into the hospital systems, will help. We'll see. Again, that's a new rollout. But I think again, text is pretty good this way because it's just to you, a couple times a week, specific to um, your loss. We talk about if there's a one patient that was special to you, and the story is one that you always carry with you and remember the dates of. There was one nurse we were talking about who worked with a tissue bank and remembers a donor who was a teenager, right, who had died, and the donation experience and staying in touch with the family that way. And this is becomes the fabric of their contributions, um, not just at work, but in the world.
Wow. I'm just I'm really thrilled to hear this and so happy that you have this project underway. I would love to do anything I could to support you in that
Oh, thank you. Well, I'd
because
love to talk about that more for sure. That'd be
yeah,
great.
I feel like that it's so needed and so very important. But in addition to that, I know that you've also been working with hospices. So I'm really
Mm-hmm.
curious to know what you're doing there, what you're offering, and how that's going.
Mm-hmm. Yeah, I mean, 5 years ago, I'd never met a hospice bereavement coordinator, and now we work with hundreds of them. In fact, two of the people that I've hired onto my small team here at Grief Coach are themselves hospice bereavement coordinators who are now working with us, and it's a really important part of our work. And for anyone who hasn't heard of hospice bereavement coordinators, I'm telling you, these people are the most amazing people on the planet. It is incredible the work that they're doing, and it's the same thing with people that do donor support at tissue banks and organ procurement. You know, there are people that spend all day every day supporting grieving people, and this matters not just because it's a nice thing to do, but because grief is a time where we have all kinds of negative outcomes, right? More depression, anxiety, substance use, sleep issues. The more supported that we are in our grief, and the more we understand that what we're experiencing is normal and that there are things that we can do, the less we see of these behaviors. There's still not a recognition that bereavement care is healthcare, but it is. We know that grieving people experience all these things, but we don't yet, as a nation, recognize bereavement care as a part of the healthcare system. The patient dies, and then what? Then the patient's not in the system anymore. So yeah, like the hospice bereavement coordinators usually come to us with a version of the same story, which is, we had 2,000 deaths last year. I'm I'm the only bereavement coordinator. I'm supposed to be supporting all these families, and I really want to. I'm passionate about this work. I have the knowledge and the wisdom and the care, but there's no way that I can keep up with this volume. And hospices traditionally have been sending out mailers, so 1 month letter, form letter, another one at 3 months, but they have no idea if they're opened. They don't know. Who knows if the family opened it or if they're, you know, grieving and probably not going through their mail in that way. So about 2 years ago, we started working. We developed a hospice program. Hospices are required in the US to provide 13 months of bereavement support. So we have a 13-month product that we then sell in packages to hospices so that they can, in addition to mailers and support groups, also offer text-based support to their grieving families. And it's been a really big part of the work that we're doing at Grief Coach, and for me, definitely some of the most rewarding. We just did a survey, so the in September, we ran a survey for Hospice of the Western Reserve, which is a large hospice in Ohio, and one of the very first hospices that we started working with. So they had family members who had been receiving our texts for that full 13 months, and they agreed to let us survey them. And I was fairly confident we would get positive feedback because anecdotally we've been hearing from people, but this was our first time running a full survey, and 96% of the grievers said these texts have helped me with my grief journey. 96% give us a 4 or a 5 out of 5, and 4% a 3 out of 5, which is still okay. And I was like, that's incredible,
Wow.
right? I mean,
Yeah, that's
that's
amazing.
incredible. So now starting to be able to roll out those same questions to our hospice families. So the bereavement coordinators often, like we've had a couple situations where the bereavement coordinator's like, oh, I don't know, this text is, I don't know if that's what people will want. I'm working in rural Wisconsin. I don't know if people will want it. Then they roll it out, and they're, I think, even themselves surprised by how well received it is, because people are like, oh, well, now I don't have to drive for 2 hours to get to the support group, or thanks for remembering my dad's birthday. The one hospice coordinator in Wisconsin is not going to remember like the birthdays of everyone who died, but instead the text messages come from the hospice, right? Hospice of the Western Reserve is pleased to provide you with the support. We know tomorrow would have been your dad's birthday. Thank you for letting us care for him. Now we want to care for you.
Wow.
So it's 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 beautiful work. I'm very proud of it for sure.
It's amazing. Like that's really a breakthrough. Like as you describe, a bereavement coordinator trying to manage 2,000 families and to offer them the right support and what they need at the right time. That's impossible to even
It's
consider.
impossible, and they're being asked to do more and more in the communities. We were talking to one sort of senior bereavement manager a few weeks ago, and so they're now getting inbound requests. The hospice is getting inbound requests from school districts.
Hmm.
Can you come? And this is often suicides of teenagers, where the school is reaching out to a hospice bereavement team. Can you please come and help us? We don't know what to do. Well, hospices in a traditional sense wouldn't be seeing suicides, right? They're caring for people whose loved one died in hospice. So not only is the volume untenable, but they're being asked to do essentially, crisis response and other causes of death, and how much can one bereavement coordinator do in their community. So, I mean, that's a larger question, but in the meantime, I'm glad that we can help, because at least then the student's family or the friends are getting something specific to suicide right away, and it lets the bereavement coordinator actually have peace of mind that everyone's getting something, instead of going home every day stressed because you know that there's a bunch of people you didn't have time for.
And
So
it's such a sign of, I guess, the lack of grief information and support in our communities, that hospice has become the de facto bereavement coordinator for the entire area, because we don't have enough of that happening in our communities in general.
we've been hearing it more. I mean, I don't think it's true. Some hospices are not doing community work, but I would say that we're hearing it usually now, that there's just an increased need, not just because of an increased number of deaths in hospice, but because they're being asked to do more above and beyond. And then, we're still talking about now a certain segment of the population that is more likely to have received hospice care and is more likely to reach out for grief support. So there's, on top of that, an accessibility issue around which populations are receiving support and how. So we also work very, very hard at Grief Coach to have a lot of support for our BIPOC grievers. We're offering support in multiple languages now, which is great. I think we're up to 10 or so languages, because that one bereavement coordinator, even if they had all the time in the world, is probably not multilingual and providing ongoing support based on certain types of populations. They might not know what would be helpful around Ramadan, for example. So,
And so do you have the texts offered in different languages and for
yeah.
various cultures and religions? That's amazing.
Yeah, we've got different languages. We're working really hard on this piece. We've launched a new series for LGBTQ grievers, which I'm really proud of, because there's a lot of disenfranchised grief if your partner dies but was never recognized by your family and so on. And I think that it's hard to, I always talk about feeling proud of Grief Coach, and I think it's because I need to balance out the other side of my head, which is like, it's not enough. The need is so huge. How are we ever going to help everybody? It feels a little despairing sometimes because the need is just so great, you know? I mean, like a Black 10-year-old in the US is something like 3 times more likely to have lost their dad, twice as likely to have lost their mom, infinitely less likely to have received any support at all. But we know that with grief, we see not only negative health outcomes, but also often financial negative financial outcomes. If your dad is shot, if you lose your dad to gun violence, what are the things now that we can statistically say more likely for you? But that kid is less likely to get support. They're less likely to have a hospice death and to have been invited to go to a summer camp for 3 days for grieving kids, right? So the need is enormous, and I do think that as a business, we're doing a good job of trying to make sure that everything is expert and quality support, but at the same time understand we have an opportunity to provide nuanced, specialized support in different situations. So what if you are a teenager whose dad was shot, right? What do you say to that kid? And most of us don't know, and how would we? So we try to help the people around that child know what to say, which helps their outcomes. It reduces the chance that they themselves um, will have negative outcomes, right?
It's so important because that you're acknowledging that grief is such a unique experience for each person, depending on who died and how the death occurred and when and all of those factors.
Mm-hmm.
And so it's almost impossible for any one of us to be prepared on our own to be a
Yeah.
supporter
No, we
for
can't. And
anyone
that's why
else's
we end
grief.
up, no. And I mean, that's
Yeah.
what brings us full circle to what you said about your dad's suicide and people's ability to respond to that, and what I was saying about Barry's, my husband. I mean, you can't. We cannot all know what to say in these really, really difficult situations. And expecting that we would makes us feel guilty. Then we stay away. Then we don't do anything because we feel we're somehow failing. Um, but it's just hard.
It's almost mind blowing to me to think that, I mean, the task for you and your staff and your contributors of actually sitting down and thinking through all of these scenarios and what
Hmm.
would be the right thing to say and what are the right messages to send.
Hmm. It's getting more and more nuanced and more beautiful, honestly. We added a new series about 7 or 8 months ago for caregivers, for people who were a caregiver to the person who died. And those messages uniformly get a positive response, because I think, you know, the woman who was caring for her husband for 3 years before he died, having that experience acknowledged back to her, and the different feelings that can come there, sometimes relief, and that's okay. It is okay to take care of yourself, even though you haven't been able to do that for all of these years that you were caring for him. Um, so, and I mean, there's so much more to do. We're working hard at the moment on our violent death work, looking at not all not all situations are the same. So someone's in a homicide, it could have been a spouse. It could have been, there's all kinds of questions that come next. So it's like, yeah, we're doing lots and there's lots more to do.
Yes, yes. You just mentioned caregivers, and I was thinking that's a group of people that could really use supportive texts even for their anticipatory grief before their
Well,
loved one dies.
that's we didn't prep this, but that was an excellent segue because that's exactly where we're focused right now. We're actually submitting some research proposals next week to expand into anticipatory grief and really be able to, because obviously grief begins long before the person stops breathing. And so
Mhm.
far, all of our 3 years of texts have been focused on people after a death, and we want to be moving to anticipatory grief for sure.
So you mentioned 3 years, so it's possible to sign on for 3 years time to get the grief
We've
support.
had people renewing. Yeah, we do. We have our the woman I was talking about in Pennsylvania who grew up on top of the funeral home is she was one of our very first subscribers, and she keeps being the first to renew. So she's into her fourth year of texts, which is
Wow.
pretty awesome. Yeah, but usually people do a year. I mean, sometimes we'll see because we're not an old enough company to see yet, but a lot of our hospices do offer free renewals. They're happy for the person to renew and keep getting support if they're finding the text helpful. Sometimes we get messages. We had one with one of my favorites was a woman whose husband died in hospice, and she said, "I'm not going to renew, but that's because I feel ready to take the training wheels off. Thank you for helping me get to this point. I feel
Mm.
so different than I did 13 months ago." And I'm ready, and I know that if I need you, you'll be there and I can start again. But for now, I'm gonna not. So sometimes not renewing is makes us feel pretty good about what we're doing.
Yeah, definitely. And am I correct? Is it possible to give grief coach as a gift to another
Yes.
person? So,
Yes. Yep. We have gift subscriptions which work very simply. You basically buy the subscription, put their email address in, and then they will get a note which you can customize if you want. But we give you suggested language letting you know Karen's bought this gift for you. No rush to sign up. We know you might not be ready now, but when you are, this is what you can
oh, I see. So they
receive.
don't just automatically start receiving the messages. They indicate
Get
that
the
they're
gift from
ready.
you like a
Then,
gift certificate, yeah, like a sort
yeah,
of
yeah.
electronic gift
Hmm.
certificate. The gift subscriptions have been happening more and more. Um, we didn't originally offer them, but it makes sense. We have people now saying that, oh, now I've bought it as a gift. It's my go-to sympathy gift. I way rather spend $99 on a full year of support for my friend than send a bouquet of flowers for the same amount of money. This feels practical and useful. One guy is a guy who's like, for him, he's like, I just want to do a practical thing that's also thoughtful.
Mhm.
So this is a gift that says, I understand that grief is a long experience and it takes time, and I want to give you something truly supportive.
And I can say it's a gift you can trust in that the messages are just that people receive are so thoughtful and caring and gentle in a way that you don't have to worry that there will be some a message that you wouldn't feel good about the
Hmm.
person receiving that you're caring about if you give it as a gift.
Thanks for saying so. Yeah, I think again we do work hard on that part, applying all the different lenses. Is it empathetic? Are we using careful about language, but also friendly and warm and at the right time?
So this is an odd question, but if I wanted to sign up just as a supporter for someone who the griever has not signed up for whatever reason, but if I just wanted the reminders as a supporter, can is that possible to sign
Yeah.
up? Oh, okay. That's
Yeah, we had some really one of the first times that happened was a couple of years ago, and it was a group of girlfriends whose friend's daughter had died by suicide. So the mom was not even getting out of bed. They didn't even tell her about it. But the girlfriends all signed up and they were all getting text reminders, suggestions. How do we help this dear friend of ours who is really, really suffering?
because I can imagine situations like that when the griever, for whatever reason, just may not be ready or able in the
Mhm.
moment to sign up for
And
this.
you can
But
also change your mind. So you can also you can be this, you as a subscriber, you can go ahead, buy a subscription and get messages just for you with suggestions for how to support your person. And later, if you want to add the person in, you can, and then they'll start getting messages a few months later. So it's very flexible. You can change it as you will. We had one, so there was these two sisters whose dad had died. He was in his 80s. Their mom was in her 80s. So they signed up to get tips, suggestions for them. How do we support our mom who's grieving and she's 3,000 miles away and we're in the middle of a pandemic? So they were getting those suggestions. And after a month or so, they mentioned it to their mom. And the mom's like, well, I don't know, maybe I would try that. I know how to get text. So they added their mom in. And then they said that this had actually become a really important part of their year because the mom would get a text and then she would call one of her daughters and say, oh, I just got this text from Grief Coach. It's talking about this. And because in her generation, there wasn't language for it or a way to talk about grief, for her, the texts were an invitation to a conversation that she could then actually pick the phone up and talk about. So that was kind of cool because it started off with the supporters, then they added in the griever, and then the grievers used the text as a tool for actually talking to people in the real world, which is kind of nice.
Yeah, I really like that. I just love how versatile it is in the moment of need.
Mm-hmm.
It has potential for everyone considered to offer what people need in the moment.
Mm-hmm.
Um,
I mean, naively, at the very beginning, back to when I was on the airplane coming up with the idea in the first place, I actually thought that might be the use case, that supporters would use it to get tips and suggestions for how to help if they didn't know how. So, and we do get that, but more often it's the griever who signs up.
yeah.
Yeah.
And then I wanted to mention for like anyone out there who might be doing grief counseling or support professionally, I've signed up as an affiliate, which means I have a special code. And if people sign up for it, the people who sign up get a $10 discount on the subscription for a
Mm-hmm.
year.
Yeah.
And so that opportunity to be an affiliate is really nice as well, to know that people will get a discount and you as an affiliate will get um, a $10 payment, I guess. Yeah.
Yeah, I love our affiliate program. I think it's amazing. It makes the subscription a little bit cheaper for the grieving person, which in the end is what we're trying to make it as accessible as we can. But it's better coming from the therapist, the hospice, the grief expert than from us, because the griever doesn't know us, right? We're the deliverer of the support, but it's so much nicer when it's recommended by your therapist, your hospice, the organization that you're already receiving support from and that you trust. So I
Yeah.
think, yeah.
Yeah, definitely. So I think if you're a provider of some sort for people who are grieving, like to at least check it out. So go to
Mhm.
grief.coach. That's the website. And you can learn everything you need to know there, it seems to me, about how things work.
I don't know. We got into it here with this conversation for lots of deeper insights as well. So that was fun. But they can
That's
also email me, Emma@grief.coach. Happy to chat with people who are interested.
And then Shelby Forsythia is helping with the affiliate program if anybody wants to sign up there.
Shelby@grief.coach. She's awesome.
She is. She's amazing.
Yeah. She
And
began as an affiliate herself. That's how we met her because she has written some books about grief, has a beautiful podcast. So originally working with her that way, and then she's now our marketing manager here at Grief Coach and helping us to build our affiliate program. And I mean, ultimately the goal is that people wouldn't have to pay for these subscriptions at all. Grief Coach is designed to be as affordable as we could possibly think of as a way to give people a full year or sometimes 13 months of support. So the reason that we're doing the research and trying to get the data is because then we could go to insurance companies and payers and say, hey, look, you can, for this small amount of money, make it less likely that a person will experience depression or anxiety or substance use or have an increase in hospital visits or all the things that happen during bereavement. So we're working to make the cost vanish eventually
the long
for the
term
for the
goal.
for the user. Mm-hmm.
Yeah. Well, I'm so impressed with what you've done, and I'm a true fan. I will say,
Oh, thank you, Karen.
So I've been impressed just for myself, just for what those messages have meant to
Mhm.
me. But knowing what you're doing and all the people you're reaching, it's really phenomenal. And then how much the potential for so much more growth and
Mhm.
so much more support for people. It's
Thank
beautiful.
you. Thank you very much. That means a lot coming from you with your depth and breadth of expertise in the space as well. So I really appreciate that.
Well, I wish you the best of luck with everything going forward. And I can't wait to see where you go next
Thank
and
you.
what comes of this. So thanks for joining me today, Emma.
Thanks for having me. Pleasure.
I hope you enjoyed my conversation with Emma and learning about how text messaging can be so supportive to people who are grieving. And as I said, I'm a big fan now receiving those messages myself. And I'm also really excited about the fact that it can be utilized for healthcare providers in the moment. And I really see this as having a lot of promise in terms of helping healthcare providers acknowledge their grief right after the death of a patient and going forward as well. And I'm fascinated to see if this makes a difference. I know they'll be studying the feedback and the outcome down the road from this intervention, but I'm really excited to see more about it. So I hope you'll check it out. Go to grief.coach to learn more about it. And if you want to sign up, use my affiliate link, which is grief.coach/EOLU. You'll get $10 off a 1-year subscription. And I will get a small affiliate compensation for that as well. But I'm representing Grief Coach as an affiliate because I really believe in the work that they're doing. So I encourage you, if it's of interest to you, to check it out, grief.coach. So thanks so much for tuning in today. If you like this content, I hope you'll share it with other people and recommend the podcast to anyone who might benefit from becoming a listener. You might help them out by showing them how to subscribe or follow the podcast on whatever app they have available to them for listening, and also do the same for yourself. Be sure to subscribe or follow and then leave a rating and review if you're so inclined, because that's really helpful when people are searching for content like this to make sure they can find it. So until we're together again next week, remember that we're here for love. So face your fear, be ready for whatever life brings you next, and love each and every moment of your very precious life. Bye-bye.